At the time of his birth, Prayan Sharma's parents were mainly concerned about his physical well-being. He was suffering from an infection and had to be transported to the neonatal intensive care unit for treatment. However, 10 days later, when he was in better health, Prayan was reunited with his mother, Nikita Sharma, in order for her to continue breastfeeding him. It was at this point that she made an unexpected discovery. In a statement to The Sun, the baby's father, Harish Sharma, explained that when his son was eventually reunited with his mother and she attempted to breastfeed him, she found something in his mouth. That object had 7 teeth on the bottom, all of which were visible. It took us completely by surprise, Harish said of the experience. The fact that a baby might be born with only 1 tooth, let alone 7, was a surprise to us. Unfortunately, those teeth caused some nursing difficulties, which prompted the parents to seek the advice of a pediatric dentist. He too was reportedly taken aback by the sheer number of teeth present. According to Dr. Meet Ramatri, the dentist who treated Prayan, this is a first of its type because it is rare that kids are born with 1 tooth, but it's never 7 teeth, according to The Sun. However, this is not the first instance of numerous natal teeth occurring. As a matter of fact, we've covered a few stories about natal teeth, including one about a baby who was born with a whopping 28 teeth. Despite the fact that no one understands exactly what causes natal teeth, it is expected that 1 in every 2,000 to 3,000 live newborns will have them. It is possible that some occurrences are due to maternal malnutrition or specific health issues, but this is extremely rare. Instead, the majority of cases are benign and just bizarre occurrences that no one can fully explain. It's important to note that teething babies are at danger for tooth decay, especially if the teeth begin to come free during the first few months of life. Babies can choke on them, inhale them, or even injure their own tongues as a result of their exposure. The presence of natal teeth might be also to make it more difficult to breastfeed for a newborn child. As a result, the vast majority have been eliminated. This was the case with Prayan's teeth when he was a child. Dr. Ramatri explained that the teeth had to be removed in order to prevent the baby from eating or choking on them. He was too young to be given regular anesthetic. Therefore, the treatment was carried out under local anesthetic, according to the doctor. It took 2 surgeries in total to remove them. 4 teeth were removed during the first treatment, and the remaining teeth were removed during the second operation. Baby endured both procedures and hopefully is now nursing considerably more effectively as a result of the extraction of his teeth. In a similar story, mother's shock as her newborn is born with 2 front teeth. Doctors and nurses were taken aback as Alyssa Bailey was born 3 days after Christmas with 2 fully formed bottom teeth. In the United States, 1 in every 2,000 to 3,000 babies is born with teeth, and surgeons frequently remove them in the event that they fall out and pose a risk of choking. A baby girl who was born 3 days after Christmas brought her parents an unexpected gift: 2 perfectly bottom front teeth on the bottom of her mouth. Doctors and nurses at Branson Regional Medical Center were taken aback when baby Alyssa displayed her impressive set of chompers, according to Jacqueline Bailey. Stunned when she came, according to her, who spoke to ABC7 about the incident. As an example, it is true that she has 2 front teeth. Are you serious? Is that true? In the delivery room, there was a great deal of discussion about it. The news of the unusual sight went quickly across the hospital, and soon other physicians and nurses were stopping by her bedside to admire the baby's gleaming whites, she explained. They were a little bit like, "What's going on? Is it okay if I just look?" "Let me have a look," Mrs. Bailey told Fox 6 that her own doctor was taken aback as the rest of the doctors. According to her, this is only the second time she's ever seen it in her 25-year professional career, she claimed. In spite of the fact that teeth are not commonly found in newborn babies, the National Institutes of Health estimates that approximately 1 in every 2,000 to 3,000 babies is born with teeth. The teeth are usually on the bottom of the baby's mouth. But Dr. Laura Corio, a clinical professor of obstetrics and gynecology at Mount Sinai Hospital in New York City, told ABC that occasionally a baby is born with more than 2 teeth. According to her, teeth can be present in oral cavities at birth and may be associated with certain other health concerns in some cases, but not always. According to Corio, doctors frequently file down the teeth of babies in order to prevent them from harming themselves or their mother when learning to breastfeed. When teeth are first born, they have little root structure, which causes them to be unsteady and potentially dangerous to children if they fall out. Alyssa's teeth, according to Mrs. Bailey, will be monitored by physicians in case they begin to fall out or become loose. When they do fall out, she will continue to grow her teeth in the normal manner. Teething usually begins around 6 months of age in the majority of babies. Getting to the tooth. Are natal teeth common? Natal teeth are the teeth that a child is born with. They affect roughly 1 out of every 2,000 to 3,000 newborns. They normally form in the lower gums and have a weak root structure, making them unstable. They're normally not well developed, but they can harm a baby's tongue while breastfeeding and cause pain to the breastfeeding mother. Natal teeth are frequently extracted soon after a baby is born because they pose a risk of choking if they're loose. Other than a child's dental development, there is no known explanation for them. They are only very infrequently linked to other medical problems, such as Ellis-Van Creveld syndrome, a bone growth disorder that can lead to breathing problems and heart failure. The newborn will grow teeth normally when the natal teeth are removed or fall out. By the age of 3, most children have a complete set of 20 milk teeth. Around the age of 5, these teeth begin to fall out, making room for larger adult teeth. However, if you picture a newborn with a complete set of teeth beaming up at his mother, you should realize that kids with natal teeth are usually born with little more than 2 teeth. A few babies have come with a substantially larger amount of their primary baby teeth present, but there have been no reports of newborns with a complete set of teeth. What is the difference between a baby's natal and neonatal teeth? A neonatal tooth erupts during the first 30 days of an infant's life, unlike a natal tooth which is present at birth. Natal and neonatal teeth have a lot in common, thus they're usually studied and discussed together. Both natal and neonatal teeth are covered in the following information. What do newborns' natal teeth look like? The lower central incisors, the bottom front teeth, are frequently the first teeth to erupt in newborns, just as they are in older babies. In some instances, natal teeth resemble primary teeth. They are, however, frequently underdeveloped. Their enamel, the tooth's hard protective outer coating, is often hypoplastic, meaning it is thin or even absent. Hypomineralized, meaning the enamel is softer than normal, and or hypomatured, resulting in tooth discoloration, and they typically have underdeveloped roots and are at least slightly mobile. Are primary teeth natal teeth? The majority of natal teeth are just regular primary teeth that emerge prematurely. However, a sizable number are not. A complete set of primary teeth consists of 20 teeth, but some children may have more than that. These extra teeth are known as supernumerary teeth, and they might cause bite problems, as explained below. Supernumerary teeth account for less than 10% of all natal teeth. Dental x-rays can be used by a pediatric dentist to identify whether a natal tooth is supernumerary. What are the causes of natal teeth? It's uncertain what causes natal teeth in babies. They could be caused by hereditary, fever, illness, or starvation, according to the researchers, but no studies have been able to corroborate this theory. Interestingly, between 8% and 62% of infants with natal teeth had a positive family history, according to several research. Is it necessary to remove natal teeth? It is debatable. When a child's natal teeth are supernumerary, they should usually be extracted. A supernumerary tooth can be diagnosed by your child's pediatric dentist, who can also help determine when the tooth should be extracted. When a natal tooth is part of a child's normal primary dentition, i.e. one of the 20 primary teeth, it is preferable to save the tooth. Primary teeth are incredibly important because they let the children chew food and speak fluently, as well as assisting in the proper eruption of permanent teeth. A missing primary tooth, unlike a missing permanent tooth, cannot be replaced with dental implants because the implant could hinder the replacement permanent tooth from correctly emerging.